A lip lift is a great procedure under local anaesthetic that involves removal of a very specific pattern of skin under the nose, so the scar's hidden in the natural crease between the nostril, the nose and the upper lip. And it's designed to reduce the distance between the nose and the mouth, increase the height of the pink lip, and also evert the lip. So when we age, and some people just because of the way they develop, the lip can thin and it can invert. So a lip lift addresses all those factors, leaving a natural looking everted lip with a fuller appearance and a shorter distance between nose and mouth, which is often very rejuvenating and gives a great illusion of changing the shape of the lower face in a more aesthetic way. Lip lift surgery is something we perform routinely at Purity Bridge. It's performed under local anaesthetic. My approach, I tend to give anaesthetic injections like the dentist inside the mouth, and once the area is completely numb around here, I then inject the further local anaesthetic into the pre-marked pattern of skin. Once the skin is excised, I release the skin further down almost to the pink border of the lip, and then the key is to have some deep stitches that are placed to anchor the lifted lip up into the base of the nose, so it A, holds it there, and B, doesn't distort the nostrils at all. Once those key stitches are in, we can place fine stitches through the skin to neaten and tidy up the final scar, and then tapes are placed on to hide the scar for that first week until stitches are out. Candidates for lip lift surgery tend to fall into two groups. There are either younger patients who have noticed they've developed an overly long nose to mouth distance and perhaps a thin lip, often people who find fillers haven't really given them the results they've hoped for. The other category of patients tend to be people who notice facial aging, and one of the ways we all age actually is by having an increased distance here. That's partly because the skin relaxes and lengthens, but also what happens is the upper lip tends to thin, become less voluminous, and it tends to invert, fold in. So the lip lift addresses all those factors, which is why it's a great rejuvenating or anti-aging procedure. Lip fillers are a popular alternative to lip lifts, and actually I often recommend my patients try lip filler before they commit to a lip lift, because at least if the lip filler hasn't given them the result they were hoping for, we've got the alternative of a lip lift. A lip lift, of course, is a commitment because it's facial surgery with the scar in a central facial location. And that's why I really want people to be very confident it's the right thing for them. Now, in a lot of people who I perform lip lifts on, they've tried lip filler and it hasn't worked for them, or it hasn't given them the result they'd hoped for. And of course, what lip filler cannot do is cannot reduce the height from the nose to the mouth. Although it can give some illusions of a change of proportion if it's done well to increase the vertical lip height. However, it's not for everyone, and that's why a lip lift has really emerged as a great potential technique. I'm often asked about whether you can have lip filler after a lip lift, and the answer is absolutely yes. In fact, what I would put to you is the fact that a lip lift can reset your starting position, and therefore, if you're in a better starting position, your response and the effectiveness of lip filler will be very different to that you might have found before having a lip lift. So actually I have some patients who've had lip lifts and have found small amounts of filler afterwards can really enhance their result even further. The scar from a lip lift is very cleverly disguised. It's hidden in the groove between the nostril and the upper lip. It then comes across and it sits very specifically in that boundary between the lip skin, which is more porous, hair-bearing in men, and the thin, delicate nasal skin. So it comes across that boundary all the way along. And I found that putting the scar there gives a better final result than some of the previously described techniques where the scar went into the nostril, because that tended to distort and blunt the nasal sill here. So I think it's a more anatomically precise way we're doing lip lifts now with this modification. After a lip lift, there will inevitably be a degree of swelling. In fact, in some people that can be really significant. I've had some patients whose pink lips have almost touched their nose with the degree of swelling they've got. That said, that settles down very quickly, and the complications we tend to talk about involve the complications associated with any surgery, such as bleeding, infection. Scar problems can be an issue often if we've taken too much. So the balance and the trick is to get that balance right, of taking enough to make a difference but not so much that it causes problems with too much tension on the tissues, resulting in a poor scar. Sometimes there can be minor asymmetries. Usually if they happen, they're often due to slight overcontraction of one side of the scar. If necessary, we can surgically revise those, but it's not normally necessary. One other thing to understand is that the result often settles and relaxes a little bit after 3 months. So it takes that long for the final bits of swelling to dissipate.